Hello and welcome back to your Therapy Guide, a podcast created to help you navigate your therapy journey. I'm Dr. Yadegarfard. In this episode, I want to talk about a very common question. What's the difference between a mental health difficulty and a mental health disorder? And perhaps even more importantly, should we focus on a diagnosis at all? This can be a sensitive subject, and my goal is not to label anyone, but to bring clarity to these terms. So let's start with a simple distinction. Think of it like this: a mental health difficulty is something that most people experience in their lives. It's often linked to a specific situation or event. Things like feeling sad for a few weeks after a breakup, feeling overwhelmed with the stress about a big project at work, or feeling anxious before a big presentation. These are normal human reactions. They can be challenging and cause distress, but they are often manageable with coping skills and a strong support system. They are often temporary, like a common cold. A mental health disorder, on the other hand, is more severe and persistent. It's not just a passing feeling, it's a set of symptoms that significantly impact multiple areas of your life, your relationship, your work, your daily functioning, and it has been persistent for a longer period of time. It's less like a cold and more like a chronic illness, something that requires a more focused and targeted treatment plan. For example, it might be the difference between feeling stressed about work and being so anxious that they cannot leave the house, or the difference between a few days of sadness and a deep, persistent sense of hopelessness that make it difficult to even get out of bed in the morning. The world of mental health is vast, and there are many different types of conditions that fall under the umbrella of a disorder. In addition to things like anxiety and depression, there is also the category of personality disorders. There is a different category altogether. A personality disorder involves a rigid, long-lasting patterns of thinking, feeling, and behaving that is very different from what is culturally expected. These patterns often begin in adolescence or early adulthood and cause significant distress or problems in your life, especially in your relationships. So this brings us to the question of diagnosis. A diagnosis is a tool, but it's not the whole story. For some, getting a diagnosis is a huge relief. It can feel like a key that unlocks an understanding of their suffering. It gives a name to what they are experiencing, helping them realize that this isn't a personal failing or a weakness. It can help them find a community of people who understand and can help them access specific support services. From a therapist perspective, a diagnosis gives us a framework to understand your symptoms and develop an effective treatment plan. For example, knowing someone has a panic disorder help us know that a specific type of CBT is the most evidence-based ways to help them. However, a diagnosis can also feel like a label or a box that a person is put into. For some, it can feel limiting or even stigmatizing, and they may worry about how that label affects their identity. They might feel identified by their diagnosis or fear that it is a permanent part of who they are. This is a very real concern, and is why we have to be thoughtful about how we use these terms. So here is the most important things to remember. In therapy, while a diagnosis can be a useful tool, it is never the full picture. Our primary focus is always on you as a unique individual and on your specific symptoms, your experiences, and your goals. Let's put this into practice. Imagine two people both receive a diagnosis of general anxiety disorder. One person's primary struggle is with constant uncontrollable worry about the future. The other person's main challenge is physical symptoms, panic attacks, muscle tension, and chronic fatigue. Although they have the same diagnosis, the therapy will look very different because we are treating their unique set of symptoms. This is a core principle in evidence-based therapy, particularly CBT. We don't just treat a label, we treat the symptoms that are impacting your life right now. We work on managing panic attacks, challenging unhelpful thought patterns, or improving sleep. We are helping you build the skills you need to manage the specific difficulties you are facing, regardless of the name we give them. The diagnosis just help us understand the general landscape, but we always work with the individual to find the best way forward. This is a core part of holistic model we discuss in episode 7, where we look at the whole person. So as you continue your journey, whether you have a diagnosis or not, remember this: you are not your label. A diagnosis is simply a tool to guide your path to recovery, not to define who you are. The focus is always on you, the person, and the unique challenges you want to overcome. Thank you for joining me on this episode of Your Therapy Guide. These episodes are designed to answer some of the most common questions my client ask, and I encourage you to listen to other episodes to find answers to your questions. Don't forget to subscribe to this podcast and follow me on my social media channels so you don't miss any future episodes. You can find all the links in the show notes. Until next time, take care.